is David Steil. I'm president of Healthcare for All PA. We invite every Pennsylvanian to become part of our movement to provide publicly funded, privately delivered healthcare coverage for every Pennsylvanian. Yay! Yay! My background is in engineering and manufacturing. I spent 35 plus years at the senior management level in manufacturing and distribution. And I then served 8 terms, 16 years in the Pennsylvania House as a Republican, just retiring after the last session. That and my business experience is what brought me here. When I got my own business and I started worrying about healthcare and my employees, and I said, whoa, I know electronics, I know instruments, I know air filtration. I don't know anything about healthcare. How am I going to do this? And I'm a small company. I don't have an HR department anymore, it's just me. So I'm trying to negotiate with people about healthcare, and I gave up. I mean, I just said, this system can't work. It's not sustainable if business is going to be responsible for providing healthcare. I am a free market person. I believe in a free market economy. I believe in the right of people to make their own choices. And that's happening today, but at the wrong level. It's at the insurance company level. And as you know, there's not a whole lot of choice. So it isn't a free market at the insurance company level. And the insurance company level is telling you what you will pay for and how much you will pay and what you will get for that. I also understand quite clearly that if we're going to have a national system, everybody wants something different. States are different. Just geography alone defines it. Cultures, traditions define it. So we're looking at a state system. It is a publicly funded, meaning tax revenue supports it, of one sort or another, and it's privately delivered, which means you select your doctor. Whatever doctor. You select your doctor. We say that this is the least costly way of providing health care. Well, somebody in here, and because everybody does at some point or another, says, yeah, prove it. Well, we have to prove it. And the way we're going to prove it is with an economic impact study. We need your help, because we need a team of people that's going to cause this to happen. And that team has to begin with networking. We make ourselves available to go anywhere in this state to talk to any group at any time about single payer, because we've got to network.
My background, is as a psychologist and as a licensed minister. And so I look for motives. Why do people do things? Why do people do anything? And it comes down to, is it desire and fear, or is it love? I love this movement because I love my family, and I love my friends, and I love myself. And when I get sick, or the people I love and I care for get sick, I want them to be able to be taken care of and to get the best healing that they can. And we know this from all religions, all walks of life, all over the world. They all know this within themselves, that healing should be accessible to every member of the tribe, every member of the village, every member of the city and the borough who gets sick. Because when somebody gets sick, somebody loves that person and wants that person to get better. Because let's face it, in Pennsylvania, 1 out of 4 is either uninsured or underinsured. And that might be a member of our family, or it might be me or you, or it might be one of my best friends. So there's lots to do. We've got to get that economic study funded, and we've got to keep reminding ourselves that unless we contribute to that, unless we make a sacrifice and ask our friends to make a sacrifice to contribute to that, it's not going to get done. So that's the first thing. And the second thing is we need to continue to educate, to use our voices to tell people that it's possible. The Berlin Wall did not come down overnight. The Vietnam War did not stop overnight. Civil rights was not won in one day.
The fight for single payer, or the fight for universal health care, dates back 100 years in the United States. A lot of you may or may not be familiar with this history, but you know, Teddy Roosevelt, when he tried to make a comeback, run for president, he actually should have gotten the Republican nomination, but he was railroaded by conservatives within the Republican Party. He ultimately ran as a third-party candidate, an independent party candidate, a Bull Moose candidate, and he declared the United States needs now to commit to universal health care. And in fact, he said, look, if Otto von Bismarck can do that for Germany back in the 1880s, the United States is this mass industrializing society. Why can't we, and why shouldn't we? And so he made it a moral crusade as well as an economic crusade, beginning in 1912. That's almost exactly 100 years ago. And now, bringing it right up to date, Medicare, Medicaid, and Social Security are all programs at risk. And they're at risk from a White House that I don't think is thinking very clearly, as well as extreme right forces within the Republican Party, as well as right-leaning forces within the Democratic Party. One of the critical things about our campaign, Healthcare for All PA, is that we are nonpartisan, and we are fiercely nonpartisan. And we want the evidence, the economic evidence, to prove our case. I think I would venture to say that everybody in this room agrees on the moral imperative of universal health care. But what's going to win this fight politically is to demonstrate that single payer will deliver health care, quality health care for all at less cost than what we're currently paying. And this is something that is long overdue for the United States. A country, as we're proud to say, we're such a great country, how can we truly hold ourselves up as a great country if we allow so many people to suffer in darkness, to die? The latest PNHP study says about 43,000? 45,000 Americans die unnecessarily every year because they don't have access to health care. And it's plummeting our economy. We're spending 17.5% GDP on health care compared to the Canadians who spend, 9%. So roughly half of what we are. And our trajectory of spending is continuing, even with the passage of the Patient Protection and Affordable Care Act, the National Health Care Bill, sometimes called Obamacare. Even with that bill in place, our costs are simply, as Dave says, completely unsustainable. Single payer is not only the cure for our healthcare system, but I believe fundamentally it's the cure for a failing democracy. I think this is the launching point. This is the issue that touches 98, if not 100% of our population who are threatened by this question of medical bankruptcy.
One of my pet peeves about healthcare in our country is how we segment it, and my issue has to do with women's healthcare. Why do we segment women's healthcare? Why do we have to have Planned Parenthood here when we should be really having comprehensive healthcare together? That's really one of my issues, and a lot of it has to do with being a woman and being so concerned about this women's healthcare. Anyway, this woman, my friend is a nurse practitioner, and she works at a Planned Parenthood in Pittsburgh, and a woman came to her with a pelvic mass. And the woman was on the waiting list for adult basic. You know there was a waiting list, then they shut it down. She was concerned about a bill. Her husband forces her to go to Planned Parenthood, which is really, Planned Parenthood provides a lot of primary screening kind of care for all issues, Anyway, the nurse practitioner found this incredible pelvic mass, and what could she do but send her on to some place where she was going to accrue a bigger bill? Senator Costa ignored the solution. He said that the General Assembly is not going to start talking about, is this right? The General Assembly is not going to start talking about health care until 2014, when they have to start talking about health exchanges in the state. That was his answer. So anyway, he writes back and says, I really do like Senator Costa for a lot of reasons. I will continue to work to find ways to ensure that all Pennsylvanians have access to the world-class health care that we have had in our Commonwealth. So there we are, and that's where a lot of our struggle is that we have to keep going back and keep going back. Am I right, Representative Steil? We have to keep going back because obviously the woman in purple is not going to go away, and I think he knows you're not going to go away, and he knows you're not going to go away.